Right.
All right, everybody, we're live.
Hi, everybody. Happy Monday. We are here as we are every Monday to do a Zoom on either a product or a health condition or a topic. Today, we are doing our CBD Pain Cream. So this pain cream, the CBD Pain Cream, we originally had brought on as kind of a trial, right? We've had 2,000 units of it, and it sold out so fast. And I'm sure you know some people are like, oh, where'd the CBD Pain Cream come? Well, we decided to bring it back, permanently. So we just had to take some time to manufacture it. So this CBD Pain Cream is amazing. And I personally have used on sore muscles. Thankfully, since we've had this, I have not had an injury of some sort, but I do get sore muscles often. And this is a godsend. Ryan, how do you use your?
Yeah,
how do you use our CBD
no, it's funny. We did the trial run, but I actually have two things going on. I've got plantar fasciitis, so my foot, it just kills me. It's a ton of pain. And for those of you out there that have had it or know about it, yeah, it's a real struggle. And also I had elbow bursitis. So when we had the pain cream, I was using it like 3 to 4 times a day and could not believe it. Actually, it was so beneficial that we spoke about it internally and said, yeah, absolutely, this product's a home run. And we got the same feedback from everybody out there as well. So today we're just going to dive in a little bit and talk about all the benefits. There's a lot of different things in this product.
Right. And as you just said, a lot of different things. So this is not just CBD, guys. There's so much stuff.
Yeah.
I'm just going to list off a few. So there's aloe vera, CBD, CBG, calendula, chamomile, witch hazel, jojoba oil, avocado oil, arnica, essential oils, menthol. I mean, so many beneficial things in this one little cream. So Ryan, tell us about some of these ingredients, what they do for us.
Yeah, this thing is so well rounded, but we call it a pain cream because the way I view it is like pain is almost ubiquitous. Almost all of us have experienced. I think everybody, right? Everybody has experienced pain in some way, some fashion or another. Chronic pain, right? Look, we're talking about arthritis being the leading cause of disability in the workplace. 25% of adults have arthritis. Shingles is one most people don't think about, but half of the population that reaches 85 years of age will suffer from shingles, and the pain is debilitating. It's a neuropathic pain, so it's a nerve pain. There's peripheral neuropathy. That's like that numbing, tingles, burning sensation in the periphery. So in your fingertips, your hands, or your feet, your toes. That's very common with vascular disorders, but also diabetes. Diabetes ultimately lends there. So we're looking at about half of the population is going to be diabetic or is pre-diabetic or diabetic. We're talking about a lot of people with peripheral neuropathy. And I can tell you from my experience in the clinical setting that options for pain management are sort of limited. Like it happens, you go like Tylenol, we know that it has a side effect profile that's significant. Advil, same way, the NSAIDs. Then you look at pain, like the opiates, and we know that that's a difficult path to navigate. And so we look at topical and transdermal as an option for pain. And really, it's quite spectacular because the results are so fantastic. One study showed about 73% of respondents had a positive increase or positive response to topical or transdermal therapy. We'll talk about that in a second here. But again, that nerve pain, the people don't know where to go. Now we're talking about a cream where you can apply it directly to the site of pain. And so that was our approach, is sort of pain management. But obviously, it covers a lot of different things as well. I mean, some of these ingredients are good for skin integrity. And we know that maintaining the skin as a barrier is very important. That's its job. But that's also the challenge, right, when you're talking about applying things topically. So did you want to stop there, Lisa, and add anything? Because I was going to go into the topical transdermal.
Yeah, well, you were talking about how it's used. Why don't you just show us real quick?
Oh, sure. Okay.
Put on your elbow so you can see actually
I was going to do that in the end, but sure, no problem. So
how it rubs in.
But I'm going to tell a little bit about, so it really does. And so one pump, we'll go over it towards the end. But anyway, I'll do this now so that we can keep talking as I'm doing. But really, it does rub in nice. But the point is you want to rub it in. So once you start using this product, it's all about that vigorous application. It's almost like therapy, like you're giving yourself a massage.
It smells good.
It smells amazing. And because of the base, the cream, the nanoparticle size CBD, it goes in and it rubs away like clean and dry. It's not even like, it's not greasy. It doesn't linger. It doesn't stain clothing. So that's all a big plus.
Right. Yeah. Nothing is worse than rubbing something in that's like really oily and then you're touching everything.
Oh yeah.
It rubs in very nice.
Yeah, absolutely. So anyway, that's the logic. That was the concept behind calling it a pain cream, just knowing that, but it does so much more, right? And
so like Arnica specifically. Like I love to use Arnica anytime there's bump, bruise. I'm always running to Arnica, and it's just so great that it's in here
Yeah,
as
but
well.
you know who's been doing that for years is like plastic surgeons.
Oh, yeah.
People like they have been recommending and using Arnica in their practice for many, many, many years. I don't know why it didn't catch on sooner with mainstream, but yeah, they're using it for bruising, swelling, inflammation, pain. I mean, it's a very versatile ingredient, and we're happy to have it in here. So quickly though, the difference between topical and transdermal. Topical is more of something that just sits on the skin surface. We know that the outer layer of the skin is a stratum corneum, and it's like a brick wall. So most topical applications will just sit there. Think about things like insect repellents or steroid creams for topical conditions, or some other things that I'm just drawing a blank on a few. I was trying to think of a few, but yeah, it's like topical antibiotics for that. They're not meant to penetrate the skin layers, because on the transdermal front, that's a different story. You are trying to penetrate through the skin layers, and it really depends on a lot, really, the molecule, and so it depends on the permeability. So really about, I know I'm geeking out, sorry, but like the molecule size matters, right? Like there's a 500 Dalton rule that's out there that does exist. And so generally speaking, it's the size, and then it's the solubility. Is it fat loving? Is it water loving? And so all these things matter. And also, like, so that was one of the benefits of looking at the CBD when we decided to go with a nanoparticle. So nano,
So
you
like,
want to pause?
just say in a nutshell.
In a nutshell, yeah, in a nutshell. Most product that you're trying to do is treating a local site, a local topical application. But in this example, we're going to talk about it as transdermal too, because of the penetrating into the layers and reaching the site of pain or inflammation.
Perfect. Yeah.
Cool. But yeah, CBD. So the nanoparticle has kind of been a newer technology. All it means is that they reduce the particle size of CBD down to basically 1/1000th of a meter. So it's extremely, extremely small. And so that allows, because by doing that, it breaks the particles all the way down. It actually increases the surface area of each CBD molecule, which allows it for better absorption, right? And better distribution through the skin layer. So that's one benefit for sure. So the CBD we know is a cannabinoid, and there's receptors in our skin, in our muscles, in our nervous system, in our lymphatic system. There are CB2 receptors. The CB1 are in our brain and spinal cord, but the CB2 is everywhere. It's on the outside. It's the outer layers, basically the periphery. So by using CBD and CBG, because those are the two cannabinoids in this cream, which they're similar, they're related, but they have been shown to have tremendous benefit with all the things we said. Inflammation, for sure. That's what you're doing anyway. You're trying to target this inflammation. So don't forget like the factor 4 and some of the other things we talk about too. And but yeah, you're targeting inflammation, so pain, swelling, bruising. What are some other things, Lisa? I mean, even like
just for CBD or this in general?
Well, it's actually CBD, but it's really with the whole product.
Right. I mean,
yeah, dermatitis, scarring, eczema. I mean, psoriasis. I mean, these are all different things you can try with. However, I will caution you, as we go through this presentation, there are some counter irritants in here, which are like menthol and camphor, and they create this hot cold sensation. So do not apply it to open wounds. Do not apply it to mucosa, like inner mouth. Don't touch your eyes after you're done. After you're done applying, go wash your hands, because you don't want to get this into anything, because it will burn. It will burn, seriously burn. But it feels wonderful right now. I mean, I can feel it. Like it just has that really. It's completely rubbed in. Zero residue remaining, and I absolutely love that. So, all right, I feel like I rambled on quite a bit. What else did you want to touch on?
I mean, I just also like the calendula and the chamomile, the calming effect.
Oh,
that
sure.
Those two ingredients have.
Yeah.
And then the
organic aloe vera.
Yeah, and then the jojoba oil, like so good for moisturizing, so good for your skin. I mean, I literally just have that as an oil that I take with me, all over anytime I travel.
Right.
I just add it to lotions, and it's great that it's in here. It's so good for your skin.
It really is. No, it's awesome. You want to see if there's any questions, Lisa?
Yes, but I will say a common question I do get with this is about any THC in this, and I think a lot of it's been a common that mothers are like, oh, my son plays for his high school sports team and he gets injuries and sore muscles. Can he use it?
Yes, he can. No THC.
Okay.
No THC in this product.
Perfect. Okay, someone's just giving a nice testimonial. Got mine in on Saturday, used it on neck pain that I've had for weeks. This stuff works. Awesome. Thank you, Dwayne, for sharing that. Okay, someone's asking about Canada. I'm
not sure.
Yeah, not sure. But I know we are not shipping CBD oil there. Peripheral neuropathy from a car accident.
Yeah, I
Nerve
understand
pain,
that.
Nerve pain. Yeah.
I understand that fully. The peripheral neuropathy is brutal for people that don't get it. I mean, it's brutal. I mean, I've helped a lot of patients over the years. And guys, when I was in the pharmacy setting, I was doing things icy hot. Remember the biofreeze? They're just counter irritants for the most part. That's the Camphor, the Menthol. What they do is they essentially desensitize the nerve endings and they distract the nerve endings. So it's very interesting to study how it works. I mean, you're basically confusing your brain on the pain signal. So interesting and non-addictive, which is great. They avoid first pass. So when you're applying topically, guys, most of these things are not getting, obviously they're not getting absorbed through your stomach. Like if you took something by mouth, that also means that you're avoiding like the liver metabolism. They call it first pass effect. And it's beautiful. You get to deliver it right to the site of pain.
No,
there's only a couple of, there's organic aloe vera.
Yeah,
But the other ingredients are not
arthritis,
USDA.
yes.
Oh yeah, arthritis for sure.
Personally speaking, Pamela, and my mother's name is Pamela as well, but she loves it for her arthritis in her hands. And when we were sold out, she was like, "Oh my gosh!" But she's happy it's back. Cumulative benefit? She looks that good to me.
Oh, cumulative benefit? No, not really. No, I mean, it's topical. That's why you use it basically 3 to 4 times a day too. I mean, obviously it wears off. There's nothing long acting about it.
Right. Perfume free. Yes. There's peppermint oil and wintergreen oil. So that's where you get the scent from.
No synthetic
Can
fragrances.
Restless leg. I mean,
Restless leg. I don't know that answer. Yeah, it might be a different ballgame, but certainly welcome to try. I'm not even sure where you would necessarily apply it.
But again, if you're having like an area like just the pain or achiness in your calf for the restless leg, I mean, you can try it there for sure.
Yeah, exactly.
Okay.
Some of the other ingredients like witch hazel, you've used as an astringent for skincare. We talked about aloe vera helps with skin integrity. I mean, you've seen everybody's basically heard of an aloe vera plant at home for wound care, even though I'm saying don't apply this to wounds. But nonetheless, it's for skin repair. It's for helping with bruising and inflammation.
Right. So, yes, neuropathy, pain, and tingling.
You have it. Yeah.
Is this considered an anti-inflammatory?
You wouldn't necessarily. It works on the inflammatory pathways for sure. We know that CB2, the cannabinoid receptors modulate inflammation. So there's definitely some effect there. And like we said on the counter irritants, the camphor and the menthol also work to distract the nerve endings. So
awesome. And guys, this is only $19.95 for members and $29.95 for non-members, but this is big. And for those of you that already have yours, you know that this is big and lasts quite a long time. I mean, it's a full bottle.
Well, it's 120 milliliters, right? So it's 4 ounces, but each actuation, so one pump is only really one ml, 1 to 1.5. So you're talking about 120 actuations that are in this bottle, right?
And a pump goes a long way.
Yeah, a pump goes a long way. I think I just did 2 pumps and covered my elbow area. So if you're doing 4 times a day, that's a 30-day supply for $20. Honestly, can't be beat. Unreal.
Lifesaver.
Unreal. Yeah. Yeah. Are you got anything else?
No.
Are we wrapping up already? That was a quick one. Oh, we usually try to keep it 15 minutes or less. So that's good. I don't think I have anything else. I just want to remind people how to use it properly. I mean, up to 3 to 4 times a day. Make sure they're washing their hands. Do not touch your eyes or any open wounds. Like I said, the smell, the texture, everything feels good to me. And then, of course, pain, when you're looking at it from a pain management perspective, we don't have a lot of options. And I love this as a tool. And also, Lisa, maybe you want to comment, like you said, the jojoba oil and some of the other things in here. Remember, like when you're talking about skin and health and all these things, that you nourish your body from the inside, not from the outside. So using this as a topical application with the jojoba oil, which I had just started using too, kind of funny for face
stuff.
And I love it. It feels great. I mean, it's really good. There's avocado oil in this product as well. Right. Take a minute, read down the ingredients list, look at everything in there, and feel free to send us an email with any questions. I'd love to hear from you guys too on testimonials for how it's helping, how it's working for you.
And one thing I want you to know when you are reading all the ingredients, I want you to note how clean these are, guys. A lot of times when you get topical of anything, there's so much added junk and toxins. Not necessary, and we don't have any in this. So this is such an amazing product.
It really is.
So yeah, if you have any other questions about it, let us know. Shoot us an email. But you've got to give it a try. And even if you don't have some situation going on right now, guys, this is so good to have in your medicine cabinet. just something that's like a staple that everybody needs for a go-to.
Yeah, for sure. And everybody knows somebody in pain right now. So
Sure.
I would, think that. And also, per pump is about 16.66 milligrams of CBD, for those of you that were wondering. But as a nanoparticle CBD, where the idea, the belief system is that it's penetrating deeper and more efficiently. So,
Cool.
guys, I hope that is all helpful and useful information for you. Lisa, do you have anything else you want to add? You want to see if there's any other questions before we drop off?
See that some came in. So real quick. I'll go to the bottom.
Yeah.
Shelf life. 2 questions on that.
Yeah, no, you're good on shelf life. So I believe I have to actually look at, I think it's 2 years from the date of manufacture. Thankfully, it's a contained unit, so you're not worried about contamination. So that's a huge plus for shelf life. But as always, please do not store any dietary supplements or medications in a hot, humid environment. Yes, please. Cool, dry, covered somewhere, but not in the bathroom.
This is not CBD oil. This is the CBD pain cream.
Yeah.
Our oil is different.
Yeah.
Can it be used on eczema on the head?
Try.
That would be interesting if you're
depends on your scalp, your hair.
Hair.
Yeah.
That would be the one thing, because
Yeah.
it's jojoba oil is rich, guys.
Yeah.
It's great for your hair. I'm not gonna lie. When I do like a hair mask, I put it in. But if you are have a lot of hair, you will be a little oily.
Yeah, try it and see.
Spot treat.
Spot treat.
Yeah, try a little area. Ooh, meniscus tear surgery. Okay, awesome. Someone had a meniscus tear and surgery, and this helped in recovery. Love hearing it.
I believe it.
Neuropathy. Has this been a relief for that? Yeah.
Yes, for sure.
Yep.
For sure. Absolutely. I've had a few patients for sure work with this exact product and this one, and got great results out of it. And a lot of times too, like I said earlier about the vigorous application, you're almost giving yourself massage therapy. I want you to focus on the injury, the site, sort of start to, feel around a little bit. That's important, and we've talked about other ways, like there's the rice therapy, the things like that. You can ice and you can heat, do these other things, but this is great to add in between. Even if you're at work, I imagine it'd be easy enough as long as your coworkers don't bother about the smell, because you can smell the essential oils.
Yes, but I hate the smell of like icy hot and Bengay.
Yeah.
I'll always say anytime I was working out and someone came by me, I know that smell. I'm sure you do too.
Yeah.
I hate it. This is nothing. This is nothing like it. This is just a nice, fresh, because the essential oils, the peppermint, wintergreen. It's a nice, fresh scent. So no need to worry about that.
Okay, cool. I think
All right,
we covered everything.
Yes.
All right, you guys all great. Have a wonderful rest of your day.
Get yourself your CBD pain cream.
All right.
Bye, guys.
Close it out. See you now. Bye-bye.